I would like to welcome you to my channel, That Middle-Aged Lady. For those of you who are familiar with me, you know that I recently had a bilateral salpingo oophorectomy, or in other words, I had both of my fallopian tubes and ovaries removed. And so I wanted to do a video for any other woman who's about to have this procedure done, or really any surgery for that matter, just to give a few simple suggestions for both before surgery and after surgery, since a lot of times our minds are very preoccupied with the procedure itself. We're not really thinking about all the different things that we might need, and maybe even aren't aware of some of the things that might happen afterward. And so my hope is through this video, I'll be able to share these suggestions to help make that process go a little bit smoother. One of the first things that I wanted to suggest is it might be helpful to go ahead and get, say, a case of water before your surgery that you can keep near your bed, even keep a few bottles out on your nightstand. That way, if you wake up in the middle of the night and are thirsty and you don't know where your water's at, or you don't feel like going, say your bedroom's on a second floor, you don't want to go into the kitchen to get some water, that way you'll have the water right there. And then I also suggest getting some over-the-counter pain medication as well, such as Motrin or Tylenol. That way you can keep it on your nightstand for in the middle of the night if you're in pain and you don't want to have to get up searching for it. So something similar to this. The next thing that might be helpful is to try and get yourself some frozen dinners before you go in for surgery, depending on what your situation is. I personally am a single mom of a 14-year-old boy, and so although he has been somewhat helpful in doing a little bit of stuff for me, he definitely isn't good at cooking. And so just to have those few frozen dinners set aside, not only for me, but that way I don't have to worry about what he's going to be eating as well. And then I also made a big pot of homemade chicken noodle soup, and then I made a big pot of homemade beef vegetable soup as well that I put in the fridge. That way both him and I can just warm it up in the microwave and make that process a little bit easier. So again, just maybe getting something like this. Another thing that we don't tend to think about is with any surgery, whether it's done laparoscopically or otherwise, the abdomen will tend to swell, and so your physician will probably want you to keep an ice pack on it. So it might be a good idea to go out and get a couple extra ice packs to keep in the freezer. That way when one starts to thaw and get warm, you would be able to exchange it for another one. So something similar to this. In case you forget, the hospital will usually provide you with an ice pack to go home, so you can always ask them for an additional ice pack to take home with you as well. In some cases, your doctor may want you to use a device called a spirometer, and this is what that looks like. As you can see, it's just a plastic device that has a flexible tube on it that you would blow into it, and then it has this little ball that you would want to try and keep up at a certain level to help strengthen your lungs. And the reason they like you to do that is because from laying down from surgery, and then you're going to be laying down once again once you get home, phlegm can set into your lungs, and then that can lead to pneumonia. So this just kind of helps to open up those lungs a little bit and help to get that phlegm up, since one of the last things you want to do after you've had surgery and have incisions is be coughing too hard, since you could possibly break one of those incisions open. So if your doctor does not provide one, I had umbilical surgery back about 3 years ago where they did. This time with the ovary surgery, they did not. So if your doctor doesn't provide one, you can always ask if it would be okay if you went out and got one, just so you can use it ahead of time, especially if you're like me where you have any type of lung issues. I have mild asthma, so I do tend to get quite a bit of phlegm, especially if I have been laying down for too long. So I do think that it does help to get that phlegm up, but you can pick them up pretty much anywhere, including at like a Walmart, and they run right around $7. Another thing that is beneficial to help get that phlegm up would be a product like Mucinex that you can get over the counter, and this is what it looks like. There are two different types of cough medicines. One is called a suppressant, and that is more for a dry cough where you don't really have any type of phlegm involved. It's just kind of like an irritation, and that helps to calm that cough down. But then there is another that is an expectorant, which is for a wet cough where phlegm is involved, and that helps to break that phlegm up, so it makes it a little bit easier for you to cough it up. And so Mucinex is an expectorant, and that is definitely what you would want to get, would be an expectorant and not a suppressant. But again, that is something that you would want to check with your doctor ahead of time and just make sure that that would be okay if you took it, assuming that, you know, after surgery you did have quite a bit of phlegm that you were having a hard time trying to get up. Another thing we don't tend to think about, especially if this is the first surgery, is that surgery often leads to constipation. And there are a few different reasons for that. For one, anesthesia is known to cause constipation. Also, if you are prescribed any type of pain medication, especially if it is an opioid, such as Oxycontin or any of the others, that can lead to constipation as well. Inactivity leads to constipation, since when you're up and moving and you're exercising around, you're getting those bowels moving, getting that stool moving. But when you're just laying there, whether you're laying in bed or sitting in a chair, a lot of times that can lead to constipation just because you're not giving enough exercise to get that stool moving. And then lastly, dehydration. A lot of times we don't want to drink water because we're sleeping a lot, or we just don't think to drink water, and that water helps to lubricate our bowels, get that stool moving, and so dehydration can also lead to it as well. And so a lot of doctors will prescribe a stool softener for you to go home with. That way it can help to soften that stool. A lot of times it has like a oily residue that kind of helps the stool to slip out, as gross as that is to say. If they do not provide that, you can always ask for a prescription of it, or if they, for whatever reason, don't want to give it, you can get a stool softener over the counter. Duralax, like this, is actually a very good one to try. And then you might want to pick up a laxative as well, just in case the stool softener doesn't work. That way you can try the laxative. But again, these are things that you want to check with your doctor ahead of time just to make sure that's okay. And I highly suggest asking for a prescription, because I have had it both with a prescription and without, and at least in my case, the prescription seemed to work a lot better. But again, make sure and check with your doctor just to make sure that's okay. Some doctors will suggest that you shower with an antibacterial soap the night before your surgery. Dial is a good one, like this. Some doctors' offices will actually provide you with a little kit that comes with that spirometer, comes with a little thing of Dial, comes with a sponge, and then they ask you to use it the night before and then the morning of, and then other doctors' offices don't. When I had my hernia surgery, they provided it. When I had the oophorectomy, they did not. So that might be something that you might want to check with your doctor ahead of time. Do you guys give a little kit providing these things? And if not, do you suggest that I shower the night before and the morning of with that Dial antibacterial soap? I went ahead and did it anyways, just because I felt like it was a good idea, and so that is something else for you to keep in mind. The next thing that they suggest, and I also did as well, is to change your sheets the night before after you shower, because otherwise it doesn't really make a whole lot of sense to shower with an antibacterial soap and then get in dirty sheets. And so you might want to change your sheets, freshen them up, even if you have to go out and buy new ones. That way you're, sleeping in a nice clean bed, and then when you get up in the morning, just kind of rinse or clean again. And that way you're kind of double protecting yourself against any type of bacteria. And although chances are, if you don't do that, nothing's going to go wrong, I just think it's like an added measure that at least gives you a little bit more peace of mind. If you have never had surgery before, you might be surprised to learn that most hospitals and/or surgical centers, if not all hospitals and surgical centers, will insert a breathing tube during surgery. They put it in through your mouth and down through your throat. And the reason they do that is just to help keep that airway open so that no fluids can come up, and also to protect your lungs as well. It's just an added measure just to make sure that you're breathing okay during surgery, because anesthesia can definitely slow your breathing down. And this is what that procedure looks like. In my case, the following day after surgery, I happened to notice that right underneath my chin was really sore. And at first I was wondering, what the heck happened? Why is my chin so sore? And then I remembered, not only did they put that breathing tube down your throat, but they tilt your head back like this, because they want to make sure when it's like this, it's kind of, imposed. But when they put it like that, it's a lot more open. And so whatever device they use to keep it in place, sometimes it can cause a little bruising or soreness there. So if you come home from the hospital and you notice that it's a little sore under your chin, you have a sore throat, those are all perfectly normal. But if it lasts longer than a week, then that might be something that you might want to bring up to your doctor. Another thing you might not be aware of if you've never had surgery before is that during your procedure, the hospital will put compression devices on the bottom of your legs and your calf area to help keep the blood flowing so that a blood clot doesn't form. And this is very important because if a blood clot breaks away, it can travel to the lungs, heart, or brain, and of course that can be deadly. So it's very important that they keep those on during surgery. When I had my hernia surgery about 3 years ago, they didn't send me home with anything, but this time, maybe because it's 3 years later, maybe this is now regulation, I'm not really sure, but the surgical center I went to gave me a brand new box of 2 compression devices for my legs, and I was told that I was to wear them for about 2 or 3 days after surgery, anytime that I was laying down or sitting up. And that was to help, again, keep that blood flowing so that a blood clot didn't form. And then if I was up moving around, then I didn't have to wear them then. And so I did do a video of what they looked like, which I'll show you in just a minute here. But that might be something that you might want to ask your doctor and or hospital if they provide anything like that for you to go home with. And if not, you can always ask your doctor if that's something you should get ahead of time and just keep at home, especially if maybe you're a little bit more susceptible to getting blood clots. It might be a good idea to ask if they don't already know that. And you can pretty much get them at any medical store. I'm not sure if they sell them at a place like CVS or Walmart, but I know that you could definitely get them at a medical store. And I do not believe you need a prescription for them. But again, that is something that you'd want to ask your doctor. But here is a video of what they look like. Here is what the box looks like. They are called Plasma Flow Mobile Limb Compression Device. It does come with 2 of them, one for your left leg, one for your right. And then how you would use it is you would put your calf right over by where the Velcro's at. You would then take and fold this over until you reach the Velcro, and then you would Velcro it into place. Sorry if this isn't coming out right. I'm trying to hold the phone while I do this. Then there is a button that you would hold down for 3 seconds until it beeps. Once it beeps, it will begin to inflate, and it will go through a cycle where I think it's like every couple of minutes where it will go ahead and inflate. It gets to a certain degree, just like a blood pressure cup does, then it stops, and then it will decompress. And then like 2 minutes later, somewhere around there, it will go ahead and inflate again. And again, all that's doing is it is helping your blood to flow in your legs so that a blood clot does not form. Like I said earlier in the video, whether your surgery is done laparoscopically or otherwise, a certain amount of swelling in your abdomen is normal, and that's because they're cutting through muscle and they're manipulating, everything underneath there. And also there's a certain amount of fluid retention that goes along with surgery as well. In a lot of the cases, especially with the oophorectomy, they do fill the abdomen up with air and they also fill it up with fluid, so it takes time for all of that to get worked out. So again, keeping that ice on there is very important to help with the swelling. But if for some reason it becomes especially tender or gets larger than what you feel comfortable with or what you think it should be, then definitely that's something that you would want to bring up to your doctor just in case something more serious is going on. And so this is a picture of what my stomach looked like 2 days after surgery. In my case, a little bit of that is fat as well, which you're not going to get rid of that fat without exercise or your diet changes. So a little bit of that is fat, a lot of it of that is swelling, and then a little bit of that is due to the constipation as well. But again, a certain amount of that is definitely normal after surgery. Another thing to keep in mind after this type of surgery is that you will have a certain amount of bleeding, chances are, that comes from your vagina, and that is perfectly normal. The hospital will usually send you home with a pad, maybe a couple extra, so you might want to get some ahead of time just to make sure and keep those handy. Whether it's just a panty liner, you shouldn't need anything too heavy, but just to have something on hand like this. I also feel like with the pad being white, it kind of helps to give you a gauge of exactly how much you are bleeding and what the color of that blood looks like. Sometimes, the inside of the underwear might be a different color. It might be harder to tell. So by wearing that panty liner or pad, it just kind of helps you to keep an eye on that. And of course, if something doesn't feel right, doesn't look right, or if you're bleeding excessively, then that is something that you want to bring up to your doctor right away. But again, just wanted to make sure you knew that a certain amount of bleeding after this type of surgery is absolutely normal and can last, anywhere from a week up to several weeks after your procedure. And so that is pretty much all I can think of to suggest, both before surgery and after surgery. I had mine about a week ago, and yes, here I am up doing a video. So as of today, I'm definitely starting to feel better. And I can tell you that the procedure was not bad at all. It usually takes about an hour, assuming that there's no complications. It is done on an outpatient basis, at least as far as every hospital and surgical center that I'm aware of. And then for the first few days, obviously you're not going to feel the best, so you're going to want to make sure and rest as much as you possibly can. Keep that ice on the abdomen to keep the swelling down. Take your pain medications if you need to, and try and stay hydrated. And then after that, as soon as you're able to get up and start moving around, I do think it's a good idea, not only to help get those bowels moving, but mentally I think it's good as well. And any concerns you have, obviously you need to make sure and let your physician know right away. But I am happy with the results so far from the surgery. Again, it's been about a week and I am definitely feeling a lot better today. But, you know, they'll tell you no heavy lifting for about 6 weeks, and you're definitely going to want to take it easy during that time. I always tell myself don't take 2 steps forward, only to take 5 steps back. And because I am very active, I have to remind myself of that quite a bit. So I just try and find that happy medium to where I am getting up and moving around and doing what I can do. But also when my body tells me, okay, it's time to sit, it's time to relax, I go and do that as well. And so if you are about to have the procedure done, try not to worry about it. Again, it should go very smoothly, and I absolutely wish you the best. If anybody has any questions or comments, please feel free to leave them. And other than that, I hope that everyone found the video helpful, and I appreciate you joining me today.